just to give you a little more background on this, Maria started working on me as the minute I walked in the door. And then when I did bring it to Dean Rothman's attention, he said, oh my goodness, Paul's attention, he said, oh my goodness, you're right. I mean, we really need a council for our providers, all of our providers. I mean, the faculty, go to the faculty meetings, and sometimes you're invited, but it's not always convenient for you to go. And then you may not be hearing about some of the larger organizational things that actually go beyond your departmental boundaries, but where you could be really valuable in helping the organization as a whole improve quality and safety and service at the point of care. So, you know, other hospitals have figured this out, other academic health centers have figured this out and have started to invest heavily in having councils and committees and organizational, better organization around the ARNP, CRNA, PA work group. The goals that we have, so we actually took this to Med Council. Dr. Rothman actually suggested that we take it to Med Council. They were also very supportive. Our Nursing Leadership Council, that is our shared governance council for nursing, also very supportive and endorsing getting the council as part of our governance structure. And then again, we went to you, and we'll show you a little bit more about the survey that many of you responded to, heavily endorsed us kicking this off. We want to increase your visibility as a professional group. We want to improve direct communication with you as valuable providers within our organization. We want to increase your involvement with strategic initiatives related to safety, satisfaction, and patient care. And we want to give you an opportunity to enhance your professional development in your professional role, not just your specialty service area or clinical area for your specialty. So I'm going to ask Maria, this is one thing we did as part of the survey. We did look at our own data to see who you are, and as of April there were 208 mid-levels that are distributed as you can see here. So the yellow are ARNPs, and the PA is the black. And you can see the different clinical areas going across the bottom. So pediatrics has a fairly large number of providers, and anesthesia, the CRNA group, is a fairly robust group. But many of the practices and specialty areas, clinic areas, have small numbers. And so again, you can seem kind of invisible within a very big department where you're an N of 1 or 2. And again, that part of the reason for this is to help people feel a little bit more connected to the whole. Did you want to?
That's the same. I mean, you know.
Any questions about this slide? This is just kind of just a tabular representation of that slide, numerical data related to which areas have which types of providers. And then information from the survey, and I apologize, this is a little bit counterintuitive. The strongly agree is the red. And so we kind of think that was green, but that's the way the thing goes. So when we asked if you all would be interested in seeing a provider council, you overwhelmingly, we had about a 50% response rate, so around 100 people responded to this, and most people said they were very much interested in having a council. When we asked if you would, we should put together a listserv, again, most people strongly agree. And we do have a listserv, and it gets updated on a monthly basis from IT, so that if someone wants to get an email out to this group, we have a means of doing that. Would you be interested in us setting up a SharePoint site so that you could exchange information, we could post information and keep you updated? And that was pretty strongly positive. If there was a website, would it be helpful to have credentialing information on there? And Maria, I know, has a personal goal of trying to work to streamline the credentialing process for ARNP and PA providers. She can talk a little bit more in detail about that. but my understanding is not everything applies to your group, and you have some special circumstances and conditions that need to be attended to, and yet you get kind of lumped in with the faculty, and that's not always appropriate. And so we want to try to streamline that process. You would be interested in attending professional development activities, really kind of aimed again at developing your role as a professional, not so much your specialty expertise, clinical expertise, but more role development in your role. And again, I think we have some skeptics here who, I know we heard from a number of people who would have liked to have been here today, but owing to your work schedules, not able to be. So some skepticism around your ability to participate, but I think in general, many of you desire some professional development. And then we did survey people about the best day of the week, which you can see this is this is like a pie that's divided into equal pieces. You know, we did pick the day of the week. Today is Wednesday, and and then we asked people about the time of the day. And again, today we picked the winner, but it was amongst very close second, third, fourth, fifth. Because it's very hard. It's kind of splintered all over the place in terms of what would really be more convenient. So I think we're going to need to experiment with this, and certainly want to follow up with you on what other times. We had somebody that sent us an email, so why could we do it at 7 o'clock in the morning, and then somebody, why can you do it at 7 o'clock at night, and these types of things. But maybe we'll come up with a way to reach people through technology, and then to hit a bullseye in terms of at least giving enough advance notice that I know many of you came in on your day off, that maybe we would be able to have a program that would attract you to coming in even on your day off. And then just for grins, we thought we'd ask how many of you knew about or know of the UI Healthcare, the new UI Healthcare Strategic Plan, and only 30% actually definitely can say that they've heard of the UI Strategic Plan. And again, that is a living and breathing document that actually tells, you know, the direction of the organization over the next 3 years. And certainly we want everybody in positions such as yours to be kind of aware of that plan, understand what it means, understand the direction that we're trying to go as an organization. And so we definitely want to get you involved in that. So, Maria, do you want to say a little bit?
Sure.